Listen, we promised you when we started the show that we would have difficult conversations, sometimes conversations about your health that are difficult to have, especially for men. And Dr. Andrew Sun has taken us down this path for difficult conversations, for important issues before. He's joining us this morning to talk about something that, again, men are less likely to talk about or address with their doctors than women, and that's urinary incontinence. First of all, for people who don't know exactly what it is, Dr. Sun, sort of set this up for us, explain to us what this is.
Yeah, so incontinence is basically a fancy word for leakage, right? So when we're talking about urinary incontinence, it means leakage of urine, either from like coughing or sneezing and the urine just kind of comes out uncontrollably, or there's also a form of incontinence where instead of being able to normally control your bladder, you suddenly get the urge to go and you have to run to the bathroom. And if you don't make it in time, then you get leakage as well.
So give me some idea of, is there a set of symptoms leading up to this, some red flags that both men and women need to be aware of so that, or is it something that is almost sudden onset? How would you describe how this materializes?
Sure. Sometimes it happens as a result of procedures. So in men, commonly prostate cancer surgery, or BPH, which is enlargement of the prostate, surgery for that can cause leakage. In women, it's also very common, usually after childbirth, among other things. And usually, it just kind of comes about relatively quickly. Sometimes it can be preceded by various other urinary complaints, like getting up at night to go to the bathroom a lot, feeling like you have to go all the time, pain or difficulty peeing, all those kinds of things.
So you outlined a situation there where you would hope after childbirth or after prostate surgery, doctors are advising their clients, these are possible side effects. These could come your way. Stay in touch with me. We'll handle it as it happens. And so those conversations are happening. But for people who are just getting up more frequently to go to the bathroom at night, they're not calling their doctor to say what's wrong. We are a society that gets to a point where we're at a crisis or we're in an embarrassing situation, and then we're tackling the issue. So you would say what to those folks?
I would say that as soon as you start to have an issue that's, bothersome, or that it's you can notice it happening, to just talk to somebody about it. The biggest thing that we can do to help improve health overall, and especially for men, because we know men are 80% less likely to seek attention than women for healthcare, is if you have a problem, mention it, right? Like mention it. Because if you can get most problems earlier on, you can probably solve it before it becomes later stage and more difficult to treat.
So when you talked about childbirth and you talked about surgery for men, those are what you call stress-induced urinary incontinence. So let's talk about treatments. What are the treatments? Is this something that's treated with medication? Is there a surgical procedure? What are the steps people can take?
Yeah, so stress incontinence essentially results from having the sphincter or the outlet being too open or leaking, and it's a physical problem and it requires a physical solution. Unfortunately, there's not really much in the way of medication that can help strengthen an opening that's too loose. And so the first thing that people start with are certain exercises to try and strengthen the pelvic floor, but really the treatment for both of these conditions in men and women is a minimally invasive procedure where we can either place some kind of sling or a mesh to kind of tighten up the sphincter, or even an artificial sphincter, like a completely implantable artificial sphincter that you can control with a little switch.
This is something that can change the way people live their lives because they don't want to socialize in a group of people if they might be in a situation where essentially they wet themselves. That's embarrassing. Or in a situation as you get older where you think to yourself, I'm going out, so I'm not going to hydrate. I'm not going to drink anything so I don't have to use the bathroom. Doesn't that lead to further complications and problems of dehydration?
Absolutely. And especially here in the South, kidney stones, which are very common, about 1 in every 8 or 9 people, primarily as a result of dehydration. I mean, of all my patients that I treat, the patients who have severe incontinence that we then treat are by far the happiest ones, because really incontinence is such a life-altering thing to have. As you're saying, you have to think about where the bathroom is all the time. You can't go out. You have to wear diapers. It's very, very socially alienating. And certainly because we have very effective treatments for it, those are some of our happiest patients.
And Lord, we know isolation is not a healthy thing emotionally or otherwise.
Indeed.
Thank you, Dr. Sun, as always, for being able to have these conversations. We want to direct people to you. here in North Texas, texasurologyspecialist.com. There is his phone number. Fixincontinence.com also is a place where you can go to get some of the questions answered that perhaps you don't want to talk about or ask somebody personally right now. And a webinar coming up as well. All you have to do is text Dallas ED to 72345. Webinar information there always. They are communicating with people in that way as well. Again, perhaps you're not tech savvy enough to go that route. Pick up the phone, make a phone call.
Definitely.
Dr. Andrew Sun, there's nothing embarrassing that you can ask him about.